Hi, my name is Dr. Mark Kellerman. I'm one of the many board-certified urologists at the Urology Center of Iowa. We offer primarily the surgical options as well as some minimally invasive options such as high-intensity focused ultrasound, cryosurgical ablation of the prostate, and then we also work with our radiation oncology partners to deliver different types of radiation therapy. Fortunately, have kind of the state-of-the-art imaging modality to help us identify prostate cancer, and that's using MRI technology, and we fuse that with our ultrasound technology in real time in the office, and that improves the accuracy of our biopsies to detect prostate cancer early. So MRI imaging has been very valuable for that. Usually it's somebody that has a family history of prostate cancer. We are identifying patients with genetic abnormalities that predispose them to prostate cancer. If you're somebody who's had a lot of first-degree relatives with other types of cancer like ovarian cancer, pancreatic cancer, colon cancer, that might be a sign that there's a genetic abnormality that you have inherited that's going to increase your risk. African Americans also, we know, tend to have a higher risk of higher grade prostate cancer. Typically with prostate cancer, especially in the era of screening, we're usually finding it before patients are symptomatic. So typically when you have urinary symptoms, that's more due to the benign growth of the prostate. With prostate cancer, you're not going to have symptoms until you have more advanced disease. And if we're doing our job screening and the patients are coming in, getting checked, we'll hopefully always find it before they're at that stage. Prostate cancer, we want to find it when it's still contained. So that would be essentially stage 1 or stage 2. By stage 3, the cancer has gotten outside of the prostate itself, but is still pretty much localized. What we don't want to happen, but unfortunately does, is patients present with metastatic prostate cancer or stage 4. And that's where it's already spread to the lymph nodes or to the bones or to other organs. And at that point, it's not curable. We have good options to manage it, and so patients can still have a good quality of life for a fairly long period of time. But eventually, the cancer gets to a point where we can't control it, and then that's obviously not good for the patient. Probably the most rewarding part of my job is knowing that I have made a patient feel more comfortable than when they walked in. And when I get that feedback, because we're not always giving them good news and they know it, but when they can say, "Thanks, doc, you've eased my mind, I feel a lot more comfortable, I feel like I know a lot more about what's going on," that's when I've done my job. Yeah, oftentimes patients are referred into the Urology Center of Iowa from other healthcare facilities or treatment centers because of our expertise in certain areas in urology. We would love the opportunity to help your patients get through their ailments and get on the road to recovery.